every adult patient gets a VPro as part of their fee. Like we actually include it in the treatment fee. So they don't have an option. It's just there. It's included. Okay. 5 minutes a day, every day. Sometimes like that first week with the first set, we might tell them 2 times a day or even 3 times a day. Our patients are seen about every 12 weeks. Usually in refinement, it says 16 weeks, but a lot of times in refinement, they only have like 8 aligners. So then they're back in about 8 weeks. They change them every 7 days. People always say, well, you're using the Propel device. Why aren't you going faster? It's easier for patients to remember 7 days. Propel has some really good research showing that 7 days was where they saw the best bang for the buck, so to speak, as far as high frequency vibration and the results. If a patient really is feeling like after 5 days, the liner is so loose or not much is happening, I let them go faster, but I don't dictate that. It's 7 days pretty much. Most of your adults aren't wearing them 22 hours. So if you get about 18, 16 out of them, 7 days is probably right on the money. It definitely impacted the patient experience. We don't spend a lot of time talking about how many hours they're wearing their aligners. It's more like, are you using your VPro? It looks like some teeth aren't tracking really well, right? That's kind of the conversation. We find that they track well, even if they're not wearing them 22 hours a day, which is probably about half of them. And it added value to our treatment because our patients are finishing treatment on time. They're just blown away that, we can get this case done. And we've heard stories, my girlfriend, she went somewhere else and she's still in aligners. Like, I'm done and she's still in it and she started a year ahead of me. And again, sometimes I don't know exactly what her girlfriend's case was, but again, that patient perception is everything, right? And they perceive that, wow, I got through treatment on time or a little ahead of schedule and I had very little discomfort.